I'm Suzanne Moffatt. I'm Professor of Social Gerontology in the Institute of Population Health Sciences at Newcastle University. Primarily I use qualitative research methods, so interviews, ethnography, participant observation, but I've always worked, primarily worked with studies that have used different types of methods, so standardized interview methods, large data set quantitative analysis. So it's primarily mixed methods, I would say, is the area of work that I kind of do research in. The research philosophies and frameworks that influence me are broadly a kind of critical social science perspective, but specifically within the field of ageing studies and within gerontology, which is looking at the social aspects of ageing, that's regarded as critical gerontological studies. And also I've been very influenced by feminist studies as well, but taking a critical approach to the question, and that's particularly pertinent when studying inequalities and the impact of inequalities on health and well-being. The research methods that I find really exciting are actually those that allow you to study the phenomenon in real depth, and for me that's really using a longitudinal qualitative approach, whether that's through interviews or ethnography, and more recently using visual methods like photo voice that we've been using on our more recent studies. So so what they do is they move away from looking at things in a snapshot, if you like, and it also enables the researcher to build up a deeper relationship with the research participants, because you're seeing them on more than one occasion. And certainly my experience of using those methods is that in doing that, you as a researcher, you get a clearer picture of what's actually going on. That's largely because people feel more comfortable to tell you or to show you what is actually going on in their lives. So a method that I've used more recently is one called photo voice, which involves participants having a camera or using a phone to take images around the topic that you're investigating. So on a recent study, we were asking people to take pictures of aspects of life that influence their health and well-being. So the individual takes maybe 10, 20 images, and then at a follow-up interview, you look at those images with the research participant. So it feels that they're leading the conversation and providing their perspective, rather than it being more from the researcher coming to impose their framework of questions on the participant. The people who inspire me methodologically are actually a number of colleagues and students that I've worked with over the years. But the two people who stand out most for me are Professor Peter Phillimore, a social anthropologist, and Professor Raj Bhopal, an epidemiologist. And I was very influenced by learning about their individual methods, but also working together across disciplines and in an interdisciplinary way. And that had a really fundamental influence on my research career right at the beginning of it. If I could tell my younger self something, it would have been to be confident about mixing methods, because when I started research, which is over 30 years ago, there wasn't the idea of mixed methods wasn't something that was current within the academy. And I think the reason that I got involved in it was because we did a survey and of the communities living around a coking works. So it was a very, very polluted environment. And this was a standardised quantitative survey. And at the end of the questionnaire, which was a postal questionnaire, people could write comments. And the comments that we got back, we got hundreds of comments. And sometimes people wrote 2 or 3 lines, but people sent us 5 pages. Some people enclosed dust from that they'd collected off their windowsills. And at that point I thought, we can't ignore these data. These are, you know, really important data, but they weren't part of the standardized questionnaire method. So what we did was we analysed those data and published them. And it was incredibly important to tell that story, tell the story of those individuals who had taken the time to tell us what effect the pollution was having on their lives. And what was interesting as well was that the results of the survey didn't show that there was a measurable health effect, but it was clearly having an enormous effect on people's lives. And so that really taught me the importance of using different types of methods to try and address the research question. The text I would recommend students to read is the Oxford Handbook of Multi-Method and Mixed Methods Research, and it was published in 2015.